So don't you think the AI can replace specialties like radiology, as we already saw one example in Switzerland? So don't you think like it will replace it in future?
Yeah, it's I'm not like, I can't deny that 100% that it will not replace, but then like, to what level it will replace, that's the question here. So as I said, it's going to replace all like very generic use cases or very generic um, outputs that like AI has, the actual like X-rays or all these diagnosis has. But when it comes to like the empathy point of view, or the point of view of understanding your patient from more like human perspective, that is something which AI will not be able to do. There are like multiple sort of like scenarios where you would see a lot of like new research that is coming in. The AI models have really high accuracy in terms of like identifying disease. So they can, according to the recent paper that was submitted by John Hopkins, AI can have better look at or better diagnosis for the X-rays or for the image visualized diagnosis than doctors, which almost like proved to be greater than 60%. So for any human evaluation, the AI evaluations will be 60% more accurate for the similar sets of data, which is like really amazing statistics coming in from the AI point of view. But for like, if you're looking at the end of the spectrum, so this is the start of the spectrum, and then there is an end of the spectrum where it is going to be humans who are going to treat the patients. That's where the human sort of like part will stay, but the parts where just the evaluation and diagnosis needs to happen, that's where AI will take over.